be mild, moderate, or severe. While there are numbers, I think that correlate to it. We're going to look at, I think it's better to look at it as an image perspective, but you know, they're defining this as less than 25, 25 to 50, and then greater than 50 of reduction in the pathway. Okay. So here, you know, just some examples of, you know, different levels of stenosis. We're going to skip these right now. Okay, so central stenosis. Okay, a normal canal. So again, normal canal, kidney bean shaped disc, still has a concavity, nice open canal. I usually tell patients it's kind of like an ovoid triangle, you know, and then really good foraminal pathway on the sides. Okay. Now, there's obviously different sources of spinal stenosis, and in this case, it's obviously a discogenic stenotic reason because there's a centralized disc herniation causing pretty significant stenosis here. Okay. Now let's look at mild. So when we think about mild, probably the first thing that we just see is that we've lost that concavity, okay, and now it's kind of either flat or maybe bulged out a little bit. So obviously it's violating the spinal canal a tiny bit, okay. Usually it shouldn't be in the lateral recesses hardly at all, if any, and it shouldn't be out into the foramen. And again, here we can see a disc, 1, 2, 3, 4. Those nerves are all doing really great. Again, that's what I'm doing every single level. Disc, look at the 4 nerves, and then the canal. Then we look at a moderate level here, okay? So we see this. So, Jason, what do you think are the causes of the moderate stenosis in this patient? What would be all the contributing factors?
So disc looked like lost some concavity. The ligament looks redundant or thickened. Those are probably the main things. The neuroforaminal looks stenotic too, but
Yeah. So let's define these all. So we have a broad-based disc bulge, right? It's across the entire back aspect of the disc. Central canal is narrowed. We have moderately. Why moderately? I think the really thing is we know what mild looks like, and we're going to know what severe looks like. And so moderate, we can still see CSF. Okay, I think that's just the simplest way to look at it. You're correct. There's a very thickened ligamentum flavum as well as very large hypertrophic facets, right? And so you can see what's happening is they're growing in this way. See, so they're growing in. This is thicker, and then this is coming at it from this side. Okay, severe. You know, no CSF. Remember, this is epidural fat right here. So no CSF, okay, when compared to a normal adjacent level. And really just can't see anything. Okay. I think that's the easiest one to see. So that's the central stenosis. So now let's talk about the lateral recess stenosis. So remember that nerve root that lies in the gutter, or the lateral recess, is the downgoing nerve root of the traversing nerve root that will come out at the adjacent inferior level. Okay. And so we can see in this case, and again, very mild, lateral recess over here at a normal level. We see it kind of narrowing. It's getting close, for instance. Whoops, it's getting a little bit close to that left one. Sorry, I can't see the right one very well here. Moderate here, okay. So the best example of moderate stenosis usually is a paracentral disc protrusion or herniation. How would you, Cindy, how would you describe this nerve root compared to that one?
That right one is compressed by the.
So do you think it's compressed?
Or
do you think different color?
I mean,
What's happened to it compared to this one?
it's been moved. Displaced. Yeah,
Yes.
displaced.
So that's the right word. So
Yeah.
we've had a displacement of the right, whatever nerve root that is. Okay.
Would be reasonable mass effect or no?
Hmm?
Is it reasonable to say mass effect or no?
Yeah,
Technically,
sure,
yeah.
I mean, it's being displaced because of a mass. Yeah. Yeah, you could say there's a right paracentral disc herniation protrusion L4-5 causing mass effect and displacement of the right descending L5 nerve root. Yeah. Okay, and then severe. It's a little funny because they flipped it to a T1 image, but the best way to think about severe stenosis is that you cannot differentiate out the nerve root anymore from the mass. Okay, so it's all up in its business there. Okay. We then also look at foraminal stenosis, obviously in the parasagittal plane to the midline of the spine. Very similar to the central stenosis, where you maybe have a normal level. We're looking for copious amounts of epidural fat surrounding the nerve root, and I actually tell patients you say, look, this is what we want to see. We don't want to see this, and they can really get that. Like, yeah, that makes sense. This is not good around my nerve. Okay. And so, you know, in this case here, we have, you know, some mild narrowing. We still see CSF pretty well around it. I think this is more mild to moderate, but when we look at moderate here, you know, you just have a rim often of CSF around it. And then with severe, you basically have no CSF signal anymore. And especially when you're comparing it to the other levels, you say, look, lady, this is clearly different. And there's no way they can't see that. And so, okay. Okay. Oh, we talked about this earlier. So, in a good example, we had a nerve root deviation or, what did we say?
Displacement.
Displacement, yeah. Nerve root displacement. And then obviously here's a compression. And if you get a good MRI, you'll actually see the it looks like a flat pancake right under the disc, okay? So, and it becomes, again, indistinguishable from the material. Okay.